I
Oh,
go to
how's it?
Michael's screen. So like where you see our faces, I click Michael and then his screen comes up.
Oh, okay. Yeah, now it is. Okay. Are you guys ready?
Yep.
All right. My name is Regina Great, and I'm here with Michael Ward and Zach Cochran, and we are going to discuss Chapter 9, Causal Comparative Research. The first slide, what is causal comparative research? Causal comparative research is treated as a type of descriptive research because it describes conditions that already exist. Causal comparative research attempts to describe reasons or causes for an existing condition. Causal comparative research is also called ex post facto research. Ex post facto is a Latin word that means after the fact or retrospect, because the researcher attempts to determine the cause for pre-existing differences in a group or individual. Causal comparative studies investigate variables that cannot or should not be investigated experimentally. They facilitate decision-making and they provide guidance for experimental studies and are less costly. In causal comparative research, a researcher selects two groups of participants, the experimental and the control group. Sometimes this is referred to a comparison group. Groups may differ in two ways. One group possesses a characteristic that the other group does not, or each group has a characteristic but no differing degree or amount. The definition and selection of the comparison groups are very important parts of the causal comparative procedure. We will go to the next slide. What types of questions will causal comparative research answer? Well, there are three types of comparative research. They differ in their purposes and the structure. They are exploration of effects, exploration of causes, and exploration of consequences. In the first type, exploration of effects, this question studies the dependent variable. What are the causes of being in a certain group? An example of this type of relationship was studied in the Army when they were considering allowing women in the infantry. They asked the question, what differences in abilities are caused by gender? And the second type, exploration of causes, this studies the independent variable. A question a researcher may ask is, what variable causes people to want to be in a sorority? Finally, in the third type, exploration of consequences, this design studies the dependent variable of an intervention. An example that a researcher question may ask is, how do students who are homeschooled react to bullying? I will be followed by Michael.
What type of data collection is used in causal comparative research? Matching is matching another control technique. If a researcher has identified a variable likely to influence performance on the dependent variable, the researcher may control for that variable by pairwise matching of participants. Each participant in one group, the researcher finds a participant in the other group with the same or very similar score in the control variable. If the participant in either group does not have a suitable match, the participant is eliminated from study. The resulting matched groups are identical or very similar with respect to the identified extraneous variable. And the problem becomes serious when the researcher attempts to simultaneously match participants in two or more variables. Another form of data collection is the comparison of homogeneous groups and homogeneous subgroups. So within this, they control extraneous variables, compare groups that are homogeneous with respect to the extraneous variable. The procedure may lower the number of participants and limits the generalizability of the findings. A similar but more satisfactory approach is to form subgroups within each group that represents all levels of the control variable. Each group might be divided into high, average, and low IQ subgroups. The existence of comparable subgroups in each group controls for IQ. In addition to controlling for the variable, this approach also permits the researcher to determine whether the independent variable affects the dependent variable differently at different levels of the control variable. The best approach is to build the control variable right into the research design and analyze the results in a statistical technique called factorial analysis of variance. So that moves us into the analysis of the covariance, which is another form of data collection. It is used to adjust initial group differences on variables used in casual, comparative, and experimental research studies. Analysis of covariance adjusts scores on a dependent variable for initial differences on some other variable related to performance on the dependent. Suppose we were doing a study to compare two methods, X and Y, of teaching fifth graders to solve math problems. Covariant analysis typically adjusts the scores of method Y to remove the initial advantage so that the result at the end of the study can be fairly compared as if the two groups started equally. The analysis of the data analysis and interpretation involves a variety of what type of data analysis is appropriate for casual comparative research. So there's two different types of statistics, the descriptive statistics and inferential statistics. The descriptive statistics consist of the mean and the standard deviation, which the mean indicates the average performance of a group on a measure of some variable, and the standard deviation indicates the spread of the scores around the mean. The most commonly used inferential statistics are the t-tests, used to determine whether the scores of two groups are significantly different from one another. Analysis of variance, used to test for significant differences among the scores for three or more groups. And chi-squared, used to compare group frequencies, which is frequencies to see if an event occurs more frequently in one group than another. All right, and I'll be followed by Zach.
How do you ensure reliability and validity in casual comparative research? Reliability is the degree to which studied data consistently measures whatever they measure. Although the term reliability is usually used to refer to instruments and tests in quantitative research, qualitative researchers can also consider reliability in their studies, in particular, the reliability of the techniques they are using to gather data. For example, as qualitative research examine the results of their inquiry, they should consider whether the data would be collected consistently and if the same techniques were utilized over time. Reliability, however, is not the same as validity. Remember, a valid test that measures what it purports to measure will do so consistently over time, but a reliable test may consistently measure the wrong things. To summarize, reliability is the degree to which studied data consistently measures whatever they measure, and reliability comes from in-depth research on several other studies as you contrast the studies across cultures. How does internal and external validity pertain to casual comparative research? Threats to external validity. Threats to external validity may limit the inferences of the results when comparing to the other populations. Brock and Glass organized the threats into two categories. One is the generalization to whom, which is the threat affecting the groups for which results can be generalized. The second is the generalization to what, which is threats to the ecological validity. Threats to the internal validity. There are 8 threats to internal validity: history, maturation, testing, instrumentation, statistical regression, and differential selection of participants, mortality, and selection of maturation interaction. A major threat to internal validity of a casual comparative study is the possibility of a subject selection bias. A researcher can reduce this threat by matching subjects on a related variable or creating homogeneous subgroups. Other threats to internal validity in casual comparative studies include location, instrumentation, and loss of subjects. This threat can be caused because of the lack of randomization and inability to manipulate an independent variable. Potential challenges. Because the groups being studied are already formed at the start of the study, the researcher has limited control over the study. Extreme caution must be applied in interpreting results. An apparent cause and effect relationship may not be as it appears in casual comparative research, only a relation, not necessarily a causal connection. Lack of randomization, manipulation, and control are all sources of weaknesses of casual comparative research.
In the first article that we chose that describes casual comparative research, it was a study on the comparison of quality of life, anxiety, and depression in children with cancer and healthy children who do not have cancer in Iran. Cancer accounts for 4% of deaths in children under 5 years of age and 13% of deaths in children aged between 5 to 15 years of age in Iran. Anxiety and depression often occur in children who have cancer and bring about various effects on children's social life, mental, physical health, and also in their disease treatment and progression. In this casual comparative study that I looked at, the study aimed to compare the quality of life, anxiety, and depression in children with cancer versus children who do not have cancer. The subjects chosen to participate in the study were children with cancer and children who were healthy. All the children were between the ages of 10 and 16. The children with cancer were visiting a Mohammed hospital based in Kermanshah, Iran in the summer of 2016. The samples of normal children who were chosen for the study were healthy children in schools across Kermanshah, Iran, through a convenient sampling. In the study, the children were all given 3 tests. The first test was the WHO Quality of Life questionnaire that was developed in the European Organization for Research and Treatment of Cancer. The second test was the Children's Depression Scale. This is a 66-item scale that was developed in 1992 to assess the depression of children aged between 7 and 17 years of age. Finally, the third test was the Revised Children Manifest Anxiety Scale. This scale was developed in 1997 to assess the children's anxiety and included a 37 yes and no questions. The results of the test show that children with cancer have different coping skills than kids who are healthy. The results also showed that children with cancer had a higher mean score for depression and anxiety than those children who do not have cancer. It also showed that the quality of life for children with cancer is lower than that of children who do not have cancer. In conclusion, the researchers found that emotional behavioral changes are the strongest and most stable element that make a difference in cancer and healthy children. I will be followed by the next article.
Article 2, a comparative study on level and direction of aggression in high and low rejection sensitive adolescents. What is rejection sensitivity? Rejection sensitivity is a psychological condition which is characterized by oversensitivity to rejection. Rejection sensitive persons expect others to reject them, readily interpret ambiguous interpersonal cues as rejection, and overreact to rejection, real or imagined. Rejection sensitivity continued. Individuals who suffer from rejection sensitivity also suffer from an abnormal amount of dread in situations where rejection is a possibility. Numerous studies show that child maltreatment places children and youth at risk for rejection sensitivity. The aim of the study was to explore the rejection sensitivity and level as well as direction of aggression among adolescents and to compare whether high and low rejection sensitive children has any pattern in the direction of aggression. The second aim of the study was to check whether high and low rejection sensitive adolescents show any particular type of aggression pattern. The results showed that low rejection sensitive girls, where girls with less sensitivity to rejection always want to protect their ego, show regression to protect ego from external and internal threats. Low rejection sensitive boys show tendency to protect their ego or attempt to show a good image to others without showing their true aggressive responses to the situation. High rejection sensitive girls respond by protecting their ego in an aggressive manner. Their aggressiveness is directed to the environment. They demand others for a solution of the problem or insist that the problem be solved by the way they want. High rejection sensitive boys, aggression is ego defensive, and in high rejection sensitive boys, they avoid situations which could possibly threaten their ego. Conclusion: the low rejection sensitive boys and girls use ego defensive type of aggression. Low rejection sensitive girls direct their aggression to the environment, and low rejection sensitive boys direct their aggression by denying it.
Article 3, Comparative Study of Parenting Styles and Parenting Self-Efficacy in Mothers of Children with and Without Anxiety Symptoms. This study aimed to examine the relationship between parenting style and parenting self-efficacy in mothers of anxious and non-anxious children. Anxious refers to a feeling of unease or nervousness towards something with an unexpected outcome. Within this article, they used two groups. The case group were what consisted of 55 children diagnosed as anxious with their mothers, and the control group consisted of 55 children with no diagnosis of being anxious with their mother. Data collected from a child behavior checklist. Data was collected from a child behavior checklist, which consisted of a standardized form that parents fill out to describe their children, behavioral and emotional conditions. Child parenting relationship scale, which was 30 questions of child parenting relationship, and a parent self-efficacy questionnaire, which assesses parent self-efficacy. These were used to compare the two groups. The results: the participants within the control group showed a higher level of responsiveness, they showed a higher level of accessibility, and they showed a higher level of parenting self-efficacy than the case group did. The case group showed a higher level of conflict and confusion than the control group. The conclusion of Article 3, with a comparison of parenting styles and parenting self-efficacy of mothers with and without anxiety symptoms, showed anxiety in children is strongly associated with parenting styles and parenting self-efficacy. Overall, parenting factors should be considered in the evaluation and treatment of preventing anxiety in children. So for me, a pro of this research would be able to be the comparing of the two groups. It seems to be easier to be able to compare and just see differences between two groups. And a con would be how there's so many different threats or challenges around this type of study.
In addition, casual comparative research is very useful in education studies. It's also cost efficient. It also helps to identify variables worthy of experimental investigation. But despite many key advantages, casual comparative research does have some limitations. Since the independent variable has already occurred, the same kind of controls cannot be used in an experimental study. So caution must be applied in interpreting results.